Probably right up there these days with getting a letter from the IRS, getting one from your health insurance company. Millions already have, and it reads something like this. Your policy's been canceled. Now get ready to pay more. Now imagine getting a letter like that. Now imagine getting 3 letters like that. Meet the woman who did, and it'll have you reaching for masking tape for your mailbox.
He should have just been specific. No, we all knew. The whole point of the plan is to cover things people need, like preventive care, birth control, pregnancy.
We all knew that people were going to have their plans canceled and their premiums raised. I covered this nonstop in Washington. I don't remember a one saying that. Not a single Democrat supporting this. And neither does this young lady. Suzanne Wilcox received no fewer than 3 letters from her insurance company telling her that her policy was being, quote unquote, changed. That was then. She joins me right now. Change generally means stopped or charged more. Which was it?
Well, they canceled our health insurance. The first letter we got is when they started the Affordable Health Care Plan, saying due to sweeping changes that they were going to raise our premiums 29% in 2011. And that followed up in 2012 with another letter saying they were going to, due to the reforms, raise our premiums another 9%, so we were up 35% premiums, followed by a letter this year from our group health trust saying they're going to cancel our insurance at the end of this year.
How did they describe the last announcement, which was probably the most damning? Were they a substandard plan, the one that the president calls not up to snuff with the new standards? What?
They just said due to sweeping changes and reforms in the Affordable Care Act that our underwriter had elected to drop our health care coverage.
So what are you going to do?
What am I going to do? Well, currently in Ohio, I spoke with our representative. We don't have an open health care exchange that I can go into. And an AVMA representative sent us an email saying don't bother going to the Obamacare website because we're not going to qualify for it. So we're going to have to seek insurance for people like me. I'm going to have to look for private insurance for myself.
And pay a lot more as a result, right?
Yes, I was told by one insurance adjuster I will be paying, right now I'm paying about $417 a month after that 35% increase over the past 2 years, and now they're going to drop us. I'm going to be paying somewhere, she said, about $1,000 a month.
Now, I don't want to get too personal, Suzanne. If I am, just tell me to shut up. But is there anything, any extenuating circumstances, pre-existing conditions, or anything like that that would get the insurance companies to pounce and say, aha? Or is this just part of not meeting the healthcare law's new standards to cover everything and then some?
I have hypothyroidism, and I also have a condition known as keratoconus from a botched LASIK surgery, but both of those are easily managed. I was told because I'm of that certain age as a woman.
Incredible. So when you hear Senator Gillibrand and others say, well, we knew this was coming. We knew this was a possibility, in fact, a probability. Now, you might have been more closer to this than I was covering it at the time, but I don't remember that. Do you?
Well, I'm just disappointed that we're not leaving healthcare decisions in the hands of medical professionals. I mean, seriously, do you want Harry Reid doing open heart surgery on you? I don't think so. I think we should be leaving this to the hands of medical doctors. We're taught in school the first thing is do no harm. And I think we need to leave the health and well-being of people and life and death decisions in the hands of medical doctors and physicians, and not in politicians' hands.
Suzanne Wilcox, thank you. Good luck through this maze. 3 times getting letters like that.